Welcome, everyone. Good morning, good evening. It's evening here in California. We're thrilled to host this information session to share a little bit about the PhD program in Global Health Sciences at the University of California, San Francisco. We'll do a pretty quick overview of key components of the PhD program. Feel free, as Tammy said, to put questions in the chat as we go. We'll try to answer some live, and then we'll leave plenty of time at the end for questions and interaction. The slides only take about half or 40 minutes. So to jump right in, I wanted to begin by introducing myself and Ali. We are the program directors of the PhD program. My name is Elizabeth Fair. I'm a professor of medicine here at UCSF. I've been at UCSF for almost 20 years now. I actually came to UCSF as a postdoc. I'm trained as an infectious disease epidemiologist. My work is primarily focused in tuberculosis research in high burden settings. This is my 8th year as the director of the PhD program. So really split my time between working in TB as well as thinking about global health education, building global health education programs, which is really where my passion lies. Ali, do you want to introduce yourself?
Yeah, of course. So my name is Ali Mirzazadeh. I'm an epidemiologist faculty at UCSF. And I work with Elizabeth and education team on global health sciences for the last 5 years. And I've been at UCSF since 2012. And my work is mostly on HIV and STI and infections around HIV and behaviors, and new sampling approaches to find hard to reach populations and engagement in study. So, and I'm super happy to have this info session and have a conversation about our program.
Great, thanks, Ali. So, appreciating some of you are here in the Bay Area, others may have never been to California or the United States. A very quick intro. The star is California. Zooming in, this is what a lot of people think of when they think of San Francisco. This is a view of the Golden Gate Bridge that connects the North Bay to San Francisco. All of this is just to introduce the idea. San Francisco is a beautiful city. It's a wonderful place to be a student, and we look forward to welcoming you here. Zooming in a little bit to UCSF specifically, the University of California, San Francisco has been consistently rated one of the top public universities in terms of clinical research, biomedical research, and the graduate schools. So UCSF is comprised of 4 professional schools: medicine, nursing, pharmacy, and dentistry. And then there's the UCSF Graduate Division, which hosts the PhD and master's programs, as well as postdoctoral training, which this PhD falls under the umbrella of. So UCSF has 19 different PhD programs, 13 different master's programs. All of this to say there's an incredibly diverse UCSF student body, over 3,000 students, over 1,700 residents and fellows, over 1,000 postdoctoral scholars representing more than 90 countries. The map here of San Francisco, all the little blue bubbles also show San Francisco itself is quite a small city. It's 7 miles by 7 miles, but the UCSF has campuses across the city. So as you can see on the far right, the Mission Bay campus, that's where the Institute for Global Health Sciences and this PhD program is based. As I said, as you could see in the last slide, we have a very diverse student body, and specifically, we have a lot of international students, a lot of trainees. More than about 50% of the students in this PhD program come from outside of the United States, and we have fantastic services and people working in the International Students and Scholars Office dealing with assisting with helping with visa issues, moving to the United States for the first time, everything in between. So fantastic support community to work with international students. Zooming in even further, this is a picture of Mission Hall at the Mission Bay campus. The third floor of this building is where the Institute for Global Health Sciences sits, which houses this PhD program. Our offices are there. Sort of a hub of global health research is there on the third floor, and also on the second floor is the Department of Epidemiology and Biostats, which also has a lot of doctoral students and master's students. So it's a really wonderful place to be a student. Very quickly, a snapshot of why study at the UCSF Institute for Global Health Sciences. So a brief history. The Institute was founded in 2003 by Dr. Haile DeBoss, who is a former dean of the UCSF Medical School, former chancellor of UCSF. He's trained as a surgeon from Eritrea, and his real passion was global health. So he is the one who really started pulling together the global health sciences here at UCSF, and has grown from an office of 5 people in 2003 to over 350 faculty and staff in the building that I showed you in the last slide. Currently, right now, there are 42 master's and PhD students studying global health in that building. We work in more than 50 countries and more than 1,000 investigators working in global health at UCSF. You can see here on the right a list of sort of major areas of focus, ranging from diplomacy and advocacy to reproductive health to pandemic preparedness. So there's huge diversity also in both where we work and what we focus on in terms of the research faculty staff programs. What's exciting about the PhD program? We're still relatively new. I realize when I say this is my 8th year as program director, we're not as new as I used to feel, but we're still a relatively young program, which launched in 2016. We do admit cohorts of students every other year. So this admission cycle will welcome our 6th cohort of PhD students that would start in 2020, the fall of 2025. We really are, I'm sure you've all done your research on other PhD programs and opportunities, and you'll see we're one of the only doctoral programs focusing specifically on global health sciences. There's many fantastic other programs that have a global health track in different PhD programs, but ours is really focused on global health as a science. As I said, we're a small, tailored, flexible program, very high touch program. We have about 4 to 6 students accepted every other year. This is just a picture of some of our different cohorts and mixing of cohorts. It is, I'll get into later, but designed as a 4-year program. So even though we admit students every other year, a lot of students, from the cohort below or above them get to know each other, often collaborate, sometimes work together on their dissertation and doctoral work. So really lovely group of students who are incredibly engaged. So the next few slides, we're going to break up into sort of the key buckets that we deliver our program in, and coursework, mentorship, research practice, and where they intersect. So first, to focus on coursework, the next slide shows, it's a slightly busy slide, but just to give you the overview, the first 2 years of the program, students are in residence at UCSF. UCSF is in a quarter system, so that's a 10-week quarter. So fall is 10 weeks, winter is 10 weeks, spring is 10 weeks. Students while they're in their coursework years, they get the summer off. Some students choose to take courses, others choose to work full-time, travel, do a research rotation, which I'll talk about. But essentially it's 6 quarters then in residence, taking coursework at UCSF. You'll see on the top here, we really balance between methods and global health content. So it is a research degree. So actually I'll start on the bottom. In terms of methods, there is a strong focus on methods. We want to make sure all of the PhD students get a really robust toolkit of research methods. So the minimum requirements are listed here. All PhD students will take at least 2 epidemiology courses, at least 2 biostatistic courses, qualitative and mixed methods training, an implementation science class, demography, and a systematic review class. So that's the minimum required methods courses. And then students will, as they decide what their independent research is going to be, will choose one specific method that they want to get more training in. So some students decide implementation science is really their calling and the best method to do the work that they want to work in global health. And so some take 6 courses in implementation science and get a certificate in that space. Others decide qualitative methods is really what they want to become the most skilled in, and will take additional courses in qualitative or quantitative, etc. Then in addition, the global health content on the top of this slide, the first column here, you'll see pro seminar. So every quarter, our PhD students take a pro seminar, which is a series really to deliver the global health content, the core global health content. And because of the nature of global health, it evolves. So we really revise these curricula as they're taught every 2 years, and the field is evolving a lot. So it's really up-to-date topics in these global health areas. So the first is global health development, history and inequality. The second, global health policy. The third, diplomacy and architecture. Then you move into sort of the systems, global health systems and financing, economics. And finally, the last quarter is really research practice and ethics, where a lot of the on the ground, we're thinking about ethics of how you want to do your research, IRB, clinical training, etc., is delivered in that. So in addition to every quarter, the pro seminar focus on global health content is a doctoral seminar that actually Ali and I lead. I like to think of it as sort of a homeroom for the PhD students. We meet every week for 2 hours. And the first year, we really focus on scientific writing, and we do a project called a year 1 manuscript, where we work with students, some students coming in with a lot of experience writing papers, others really haven't had that experience. And given a PhD, the deliverable of a PhD is a dissertation that's comprised of 3 research papers. We want to make sure everyone has really foundational training in how to write scientific writing and how to specifically write a manuscript. So we work on that from the first quarter, getting a data set, the second quarter really working on tables, how to write results, the third quarter really putting it all together into a publishable paper. There's a lot of peer learning in this space. All the students get to know each other's work really well and really collaboratively, and it's a way to both build community and also for us to provide consistent mentorship throughout those 2 years. The second year of doctoral seminar, it's a similar focus, but it's on grant writing, appreciating the fact that there's a real currency even at an early age or early stage for PhD students to start competing for their own funding to support their research. And some are very successful, others are not, but it's a great skill to have, both to be able to write a grant, write a research proposal, etc. And so we focus on that in the second year of the program. Mentorship. I've alluded to this a little bit, especially talking about how we interact in doctoral seminar, but mentorship is a real core to this PhD program. As I said earlier, it's a really high touch program, not just from myself and Ali, but also from a team of advisors. So all students will be assigned an academic advisor when they come into the program. The academic advisor really works with each student to figure out that academic progress, what courses they want to take, professional development opportunities, networking, etc. And then towards the end of the second year, students are identifying their research advisor, and this person is more someone who they probably would be doing their independent research with. Perhaps they're nesting their own research ideas into an existing grant or partnership, or working with this research advisor to develop their own research ideas. So these 2 advisors are really core to PhD student success. In addition to them, they both serve on the student's doctoral committee. So then a doctoral committee is of 4 people, 4 faculty from UCSF, which includes both academic and research advisors, as well as 2 other faculty members who we work closely with students to identify the right people, both to give support in terms of research progression, research ideas, but also networking, career advice, etc. So it's really not until the end of the second year that students have sort of their final doctoral committee assembled, but that is a team of people who's really supporting each student for the next 2 years when students are doing their independent research. So moving on to research practice, in addition to the required coursework, we require research rotations and teaching residencies. So first, we require 2 research rotations. So they're quarter-long opportunities to do applied research. And it's sort of, there's a couple different ways that research rotations can play out, can look. And one is a very traditional way of working with a faculty member, maybe someone you think you might want to work with, to really see if it's a good fit, to learn about what they're doing, work on a discrete project for 1 quarter to see, learn about the research they're doing. Another purpose this serves really is to work in a different area of global health. Some students come in and have worked in one specific area or one specific region, and we want to encourage students to branch out to learn something new. And so finding a faculty member or a project to engage with, to learn something completely outside of your current wheelhouse, it's a fantastic opportunity. And some students come in fresh out of school. Some others have been working for a long period of time, and it's a wonderful opportunity to sort of put that student hat back on and say, hey, I'd like to work with you. And it's a very low stakes way to sort of begin to network with people in different research areas. The third way students sort of engage with research rotations is looking for opportunities to work outside of academia or with other partners. And as I say here, often this is in the summer between the first and second year. We've had students do rotations at CDC, at WHO, apply to fellowships at Gates Foundation, the World Bank, etc. So some students are interested in seeing what their research looks like from outside of academia from a different angle, and that's a wonderful way also to just increase your network and see how others are engaging in the field that you're interested in. The second sort of applied way opportunity we create for students are teaching residencies. This is essentially being a course assistant, a teaching assistant to a class that you've taken. And some students use it to say, hey, I really want to see that content again. I want to really make sure I know biostats 2 incredibly well. So they'll choose to be a course assistant for that class, or one of the pro seminars. They really love the faculty who teaches global health policy, for example. And so they'll say, I really want to get to know that faculty. And it's essentially acknowledging also a lot of people do a PhD, choose to do a PhD thinking you might want to be in academia. So it's a nice way to get a little bit of experience for future educational roles, including as faculty. So this slide just shows examples of student-driven research. Our students, the PhD program in global health science is incredibly broad. As I said before, it is a research degree. It needs to bring to bear and engage with rigorous research methods, but the content, the topics that students choose to work on is really exciting. And the field of global health is really evolving. And so I also think of our students really as sort of framing what the academic field of global health is. And so as you can see here, the diversity of both ways people engage in global health research, not just the geographic spread, but the type of the topics. So we had one student working One Health research, focused on pandemic response in Uganda. We had another student who recently graduated doing geospatial research. She took a lot of spatial epidemiology classes, applied to malaria elimination, and she had 3 different papers from 3 different countries, but applying a similar methodology to that. We also really believe global is local. We have one student working on qualitative and systems research on poor quality obstetric care in Tennessee, here in the United States. And then we have some more traditional sort of clinical and epidemiologic research based in Tanzania, et cetera. So I also recommend, if you haven't looked, our website has a list of all of the students, current students and alums, that has a description of the research they've done, so you can get a sense of what that spread really is. Very quickly to go over progression milestones. As I said, this, you can see here, it's designed as a 4-year program. The first 2 years is focused on coursework, which we've gone over. After the second year of coursework, students, they form their doctoral committee, they sit for qualifying exams, and then defend their dissertation proposal, their research and dissertation prospectus. And once they've passed qualifying exams, usually in the summer after their second year, technically they are PhD candidates and embark on 2 years of independent research. Some students get it done faster, some take a little bit longer, but we really believe that 4 years, 2 years of independent research is the sweet spot to continue progressing and able to get 3 research papers done, and not spend too long in your PhD, because you want to get on to the next step. And the dissertation research really is conducting original research in your chosen area. You write a dissertation and you present and defend your dissertation. So a couple quick slides on FAQs, facts, frequently asked questions. This is the one that we get the most. How much does it cost? Are there scholarships, etc.? So talk a little bit about financing your education. We like to support our students as much as we can. As you can see here, the first 2 years of the program are typically covered by the PhD program. Everyone comes in with a slightly different scenario or package or opportunities to work with people. But we really like to work with you to have the first 2 years of the program covered, and then work really closely with students to write grants or get on their research advisors grants to be supported for the second 2 years. And we've been quite successful in that. As you can see listed in the second bullet, over the last few years, students have received a lot of different kinds of fellowships, both within UCSF and outside of, to help support that. Which, as I referred to earlier, it's obviously great to have your education covered, but it's also sort of that first step in demonstrating the ability to get independent funding, which for academic research career is really critical. So it's a great opportunity, and that's why in doctoral seminar we really focus on grant writing in year 2. One slide on the admissions process. Hopefully you've all been able to see this. Is all on our website. The application requires transcripts, letters of recommendation, a CV, a statement of purpose, application fee or a waiver for that fee, TOEFL scores if required. The GRE is not required for admissions. And this below shows the timeline. So applications are due December 13th. We will be inviting people for interviews on Zoom in January, maybe into February, and decisions and offers will be made in the spring of 2025 for matriculation in September, early September 2025. One last slide just to give a little unsolicited advice here, and then we'll go into questions. I really encourage, if you're serious about this PhD program, read about faculty members and research groups at UCSF who match your interests. We appreciate there's other programs you can look at. We want to make sure it's a good fit. We want to make sure what you really want to do for your doctoral work is well served by the faculty and staff that we have at UCSF. So want to make sure that there's a good fit with ongoing research and faculty that you'd be interested in working with. In your application, we encourage you to tell us which faculty or research groups you'd be most excited to work with. You don't have to have talked to them or even know them, but you can read about them and say, this looks fantastic and I would love to be a part of this group, and this is why, and this is the experience I have, etc. And finally, in your statement of purpose, really providing a clear sense of who you are and why this program specifically is a good match for your interests really helps us. We want to make sure it's a good fit too. We don't want to accept students who we can't support, whether we don't have the, research going on or something. So getting the best sense of who you are and why UCSF is a good fit for you is really helpful for us to then think about who advisors might be, etc.